As a palliative care physician, I read a lot of patient notes and I talk with healthcare providers of all different specialties to get the best possible picture of how my patient is doing so I can give the best possible guidance. And in the process, I've read and heard all kinds of inaccurate information based upon misunderstanding healthcare providers have about their patients. And sometimes a misunderstanding can really change the course of someone's medical care. Last year, I was asked to speak with a patient in his 50s. He had end-stage liver failure with cirrhosis. Cirrhosis is scarring of the liver due to long-term damage. And he'd been in the hospital for a little over a week, and all the notes mentioned cirrhosis due to alcohol use. When I asked his primary medical team, it was a new team due to shift change, I asked them, could this patient be eligible for a liver transplant? And they said, well, all the notes say that he has cirrhosis due to alcohol use. I assume he's still drinking. So no. When I met with the patient and his family, I asked him about his drinking. And his daughter replied, what are you talking about? My dad hasn't touched alcohol in over 2 years. We understand he's very sick. And if there's absolutely nothing we can do about his liver, we want to bring him home and focus on his comfort and his dignity with the help of the hospice team. But if there's a chance that he could potentially get a liver transplant, we want to take that chance. And the patient who was listening nodded in agreement. I relayed this piece of information to the primary medical team, who later consulted the GI gastroenterology team. And by the end of the following week, this patient was being transferred to another hospital for evaluation for a possible liver transplant. And these types of misunderstandings don't just occur in the busy hospital setting, they also occur in clinic. I was once asked by a primary care physician to check on one of her patients with, she was an older lady with moderate dementia. She said, oh, my patient used to go to adult daycare every day, but 2 weeks ago she fell off of a step and she did get evaluated in the ER. And didn't have to be admitted into the hospital, but she hasn't been back to adult daycare. I'm really worried about her ability to get around, that maybe she's not moving like she used to. So when I met with this woman, I saw an immaculately dressed older woman with lipstick on and her hair curled. She also had large bruising under her left eye and big scratches at her left temple and left cheek. And she told me, I think I'm getting around okay. I'm still using my walker and I'm doing fine. I don't want to go back to the adult daycare and see my friends until my face is healed. I have pride. I happily relayed this piece of information to her primary care physician and reassured her that her patient was doing okay. In this era of shorter and shorter clinic visits and longer patient lists with increasing medical complexities in the hospital, I see more and more instances of misunderstanding between healthcare providers and their patients, and less opportunities for clarification of that misunderstanding. I would suggest one of the things you could potentially do to advocate for your best possible medical care is to ask to speak directly with the doctors about updates, to relay your questions, maybe speak with multiple healthcare providers to get multiple opinions if that were possible, and then to relay any information that you think is pertinent, that you think is important to the doctor, even if the doctor doesn't specifically ask for that information. I hope this was helpful. Thank you for listening. I'm Dr. Jeannie Lee with Real Palliative Care.